You know, if you're a cat owner, there's a good chance you've had that little moment of worry. You're looking at the litter box and wondering if everything is, well, moving along like it should. It's a super common issue, and that's exactly what we're going to dive into today, so you know exactly what to look for and what to do.
Yeah, it really starts with this simple question, doesn't it? That little bit of worry creeps in when you peek in the box and realize, I haven't scooped anything substantial in a day or two.
And if that's you, trust me, you are not alone. So, we're going to break this all down nice and simple. The goal here is to give you the confidence to figure out what's going on and what your very next step should be.
Okay, so first things first, how do you actually know if your cat is truly constipated? Let's get right into spotting the signs.
All right, it's actually really helpful to know a couple of key terms here. First, you've got constipation, which is what we all think of, difficult, infrequent, really hard stool. But it can get worse and turn into something called obstipation, and that's a complete blockage. That's the really serious stage we absolutely want to avoid.
Now, what's so interesting here is how many of these signs have nothing to do with what you find in the litter box. It's about what you see. Is your cat crying out when they're in there? Are they making a ton of trips, but nothing's happening? Maybe you notice they're walking a little stiffly, or they've got that kind of hunched posture. And believe it or not, even vomiting can be a sign, because when the whole system gets backed up, it's got to go somewhere.
So, what's considered normal? What's the baseline we should be looking for? Well, this quote from Dr. Joya Griffin gives us the perfect benchmark. If your cat is eating normally, you should be seeing them go about 1 to 2 times a day. Think of that as the gold standard for a healthy, happy gut.
Okay, so we know what to look for, but the big question is, why is this even happening? Let's dig into some of the most common culprits.
And this chart breaks it down perfectly into 2 main buckets. On one side, you have the lifestyle causes, and a lot of these are things we can actually control at home. We're talking dehydration, not enough fiber, or even just a dirty litter box that your cat just refuses to use. But on the other side, you've got the more serious medical issues that really need a vet's help, like chronic kidney disease or some kind of intestinal blockage.
And this is so important to understand. Constipation is almost always a symptom, not the disease itself. It's basically a giant red flag. It's your cat's body trying to tell you that something else is off. It might be a sign of a much bigger issue, especially dehydration, which is often tied to things like chronic kidney disease.
Okay, so we've covered the what and the why. Now for the most important part, right? What in the world do you do about it? Let's get into your action plan.
All right, for a mild, maybe once in a while case, here's where you can start. Number 1, always, is hydration. Cats are just not great drinkers, so little things like getting a water fountain or switching to wet food can make a world of difference. Next, get them moving. A little playtime with the laser pointer stimulates their gut. And of course, a super clean litter box is just way more appealing. And don't worry, we're going to talk all about fiber in just a minute.
Okay, everybody, I really want you to pay close attention to this. These are the serious red flags. If it's been more than 48 hours since your cat has pooped, or if you're seeing any of these other signs, especially if they're vomiting or clearly in pain, it's time to stop the home remedies and call your vet. I mean it, immediately. This is not a wait-and-see situation anymore.
Okay, remember how we mentioned fiber as a home remedy? Let's circle back to that. It's something people recommend all the time, but how does it actually work? This is actually pretty fascinating, because fiber isn't just one thing. You've got soluble fiber, which basically acts like a sponge, pulling water into the stool to make it softer and easier to pass. And then you have insoluble fiber, which is more like a broom. It adds bulk and physically helps push everything through. A really good fiber source will have a nice mix of both. So what's the easiest, safest way to add that fiber into their diet? You guessed it, for most cats, it's plain 100% pure canned pumpkin. It's easy to find, most cats don't mind the taste, and it's got that perfect mix of soluble and insoluble fibers we were just talking about.
But how much do you actually use? Well, you really don't need a lot. The trick is to start small. Just mix about half a teaspoon into their food once a day. If you need to, you can gradually work your way up to a full teaspoon, but always start slow and just see how their system handles it.
And please, this is a super important warning. Make absolutely sure you're buying plain pumpkin puree, not pumpkin pie filling. That pie filling is packed with sugar and spices like nutmeg, which can be straight up toxic to cats. So always double check that label.
Treating a problem when it pops up is one thing, but preventing it from happening in the first place, that's even better. So let's talk about how to set your cat up for long-term digestive success.
Think of this checklist as your blueprint for a healthy cat gut. And hey, do you notice how a lot of these points sound familiar? They echo the at-home remedies. That's because the best long-term prevention is all about consistent daily habits. A diet rich in moisture, tons of fresh water, daily playtime, and keeping them at a healthy weight. Oh, and regular grooming to cut down on hairballs, that's a huge one too.
So as we wrap things up here, let's just end on this question. Looking at everything we've talked about, what's just one small change you can make for your cat today? Seriously, right now. Maybe it's just swapping out their water, or committing to a 10-minute play session later, or maybe just adding a little spoonful of wet food to their dinner. Remember, it's those small, consistent changes that really build a lifetime of good health.